Welcome back, everybody, to the OPT Network. This morning, we're talking about a very serious situation, health crisis in central Louisiana. We're talking about COVID-19 and the cases rising. Here to join us from Christus St. Cabrini Hospital is Dr. Zapatero. Dr. Zapatero, good morning and welcome.
Good morning.
You know, I hate that we're having to have this conversation because so many people felt hopeful. We've taken off masks. We've really let our guard down, but we are really seeing a surge of the virus. Talk about what you're seeing at the hospital.
What we're seeing is a really rapid incline. In the beginning of July, we only had 3 patients in the hospital that had COVID. Today, we have 43. The main strain of COVID that's in Louisiana is Delta, and the Delta is known to spread really fast, and we're really seeing this rapid rise of cases. The majority of the people who are coming into the emergency department have not been vaccinated. There are a few cases of patients who had been vaccinated, but those are few and far between. We know that the vaccines are not 100% effective, but they're between 90 and 95% protective. And the people who are having the breakthrough, it tends to be because they've been in close contact with people who had an acute COVID infection. So in one case, the patient was in a car with a person who had COVID for a long time. It was a long trip. So they're being constantly bombarded with this Delta variant, and then that's how we're getting some of these breakthroughs.
Wow. What do we understand, if and anything at all, about this new strain called Delta?
Well, this new strain, it tends to cause higher titers or higher amount of viral load, higher than the previous one. So that means that before they start becoming symptomatic, they're shedding a lot of virus, more than before. And people who are exposed, they're being exposed to a higher amount of virus. And then that gets them sicker quicker. We also are seeing more young people having severe COVID symptoms. A lot of this has to do with, if you're exposed to the virus and you're exposed to very little, your body, while the virus is growing, your body is mounting the defense against it. But if you get bombarded with a lot of virus from the beginning, you're going to deteriorate really rapidly before your body can mount an immune response. And so we're seeing people that are coming in really sick, and they're getting sick really fast.
Wow. And so was the hospital prepared at all? Did we know that there would be another surge? And did we know that it would be this soon?
Well, I think we were always, as far as being prepared, we have been prepared. Unfortunately, only about 32% of the population of Louisiana, and in Region 5 and 6, it's lower than that, of the people are vaccinated. The vaccine definitely is protective. And when we see the states that have higher vaccination rate, we don't see as much. So this has been a concern that we've had. We've been hopeful. But it's a concern that we've had. We've been continuing to have the vaccine at our clinic, and I know that public health has, to try and encourage people, but people have been a bit reluctant. Because of that, we have been prepared. The concern that we have now, and all of Louisiana has, is this really has been a rapid rise. And it's possible that the numbers now will surpass the prior surges. And it's really placing a huge demand on the entire health system. We've had hospitals in Houston contact us because they wanted to transfer patients here. So this is something in the whole area. There's a shortage of hospital beds. As long as we're talking about this, another thing that is important is people who are positive, to try and get the monoclonal antibody as soon as possible, because that can prevent an admission. When we see that the hospitals are inundated with patients who have COVID, anything that we can do to protect a person from getting sicker is important. I do just want to point out a couple of things. The monoclonal antibody that's used now is Regeneron, and Regeneron has a broader application. It includes people who are overweight, not just obese, so if their BMI is over 25. Also, people who have sickle cell anemia before was only for pediatrics. Now it's for adults also. And women who are pregnant.
Now, what's
would
the
also.
time frame, Dr. Zapatero? Because we know from the previous virus that people are asymptomatic or without symptoms before they get sick. So what's the time frame from when you're positive or begin to have symptoms to when you can get the monoclonal antibody?
Well, you have 10 days from when you start having symptoms. But what the research shows is the sooner you get the monoclonal antibodies, the better. Particularly because this virus, it just rapidly ramps up and you may be exposed to a high load. You can get sick really fast, and having those monoclonal antibodies as soon as possible is really going to help your immune system fight it.
Mm-hmm. And so what do we need to understand about vaccination? Because in those states where where the percentage of people has been higher and they've been vaccinated, they're seeing less of the virus. Help us to understand what not being vaccinated has done to create the problem in the situation that we're in right now.
If you're not vaccinated, you don't have antibodies to protect yourself against the virus. So it's fertile ground for the virus, to infect and also to create new variants. And we know that the vaccine, it does work. It is effective. It's effective against the Delta strain, somewhere like around 90%. And the people who do get it tend to have much milder symptoms. So it's also protective against having severe COVID. So even the people who have the breakthrough, they may not require going on a ventilator and being in the ICU. But it really does have a huge effect. The other thing I just want to try and point out is the mRNA vaccines like Pfizer and Moderna. What they do is they produce the spike protein, and that's all that they do.
And tell us what that means. What does that mean?
So the spike protein is, when we see photos of the COVID vaccine, of the COVID virus, it looks like a crown around the outside of the virus, and it's drawn usually with little circles. Well, those little circles are going to be the spike protein. So what the vaccine does, it has your body produce some of the spike protein so your body can develop antibodies against the spike protein. If you get COVID, it's going to produce the spike protein, and it's going to do a lot more damage. So what this basically is, the important thing about this is that the vaccine cannot do more harm or do anything that COVID itself is not going to do. Mm-hmm. And if you have not been vaccinated, it's just a matter of time before you are exposed to COVID. So,
wow, just a matter of time. Let's take a break here, Dr. Zapatero. But when we come back, I want to talk about going back to school, which we're just literally a couple of weeks away from back to school. And I want you to help us to understand these variants. And I think that this was something that most of us didn't expect and didn't know would be coming. Also, RSV and the flu are on the rise as well. So we've got a lot to talk about. Stay on point, everybody. We're back with more right after this. Welcome back, everybody, to the OPT Network. Our guest this morning is Dr. Zapatero. He joins us from Christus St. Cabrini Hospital, and we're talking about what we and our families and our community need to understand about the new variant or the new strain of COVID, Delta. And so, Dr. Zapatero, we're talking about the numbers. You've seen them really skyrocket at Cabrini. And we know as kids are going back to school, you're also having issues with RSV and the flu. Tell us how that all plays into where we are right now.
It is important, particularly the RSV and the flu. While people were wearing the mask, those viruses were not being spread. So we were not seeing the flu. We were not seeing RSV. Now that people are not. Are you
serious? So because we were wearing the masks, we didn't have issue with that. Now we take the mask off and we're starting to see it.
Correct. From, when you look at the entire winter, we had no positive flu cases in the hospital at Cabrini. And RSV was also incredibly rare. as soon as people started taking off the mask, we started seeing a lot of pediatric cases. And we've had combinations of RSV with COVID. So then these children are being hospitalized because of the combination and just more of this virus that they just haven't seen in the past several months. The important message about this is that the masks do work and the masks do protect children, particularly with school, which is going to be opening starting sometime soon, is going to be wearing the mask is crucial to protect the children in the community.
Tell us how RSV is presenting in the children.
So RSV is respiratory syncytial virus. The first part of it, the respiratory, is stressing that the pediatric patients, children, are presenting with respiratory complaints. They're going to have coughs. The coughs are productive. They're going to be short of breath. In severe cases, then they have to be put into the hospital. They have to be given supplemental oxygen. And in more severe cases, they may need to be intubated. So the RSV has been it's been around, for decades and decades. And we know what's happening now is that many children have not seen it, and now all of them are being exposed at the same time.
Wow.
So many hospitals have seen also a sharp rise in RSV.
But if you have small children, this was something that every parent knows at some point we deal with, and it didn't ever really present that much of a danger, but now it's being compounded with this new variant and then COVID.
Correct. It's being compounded with COVID and also with the flu. The other thing is that because it's all happening really quickly, people took off the mask at the same time, then a lot of children are being exposed at the same time, which then also does create a strain on the entire medical system and the ability of children to be receiving care.
Okay, so there is no longer a mandate for masks. So you're right. Everywhere you go, very few people are wearing masks. So what can we expect? What should we as parents and teachers, what should be the protocol? I know hadn't been mandated yet by the governor, but with all of these cases that we're seeing, is it going to be recommended that kids and teachers wear masks?
Well, yes, the masks definitely do help, and to protect our children, I think it's crucial. And the other thing is the social distancing, so that the kids are not one on top of another and can easily transmit the virus. So the social distancing and the wearing of the mask is really crucial.
Mm-hmm. So I think this is another source of confusion. When we first got into the virus and what we were seeing in terms of death, it was much older people. We had some people in between, but we felt, or the science seemed like it was leaning, and correct me if I'm wrong, that it was going to be more deadly to older people. Now we're seeing that it is deadly to younger people. The word and the understanding that we got is that younger people would not be affected, in a fatal way. Why has that now changed?
It's changed because of the mutations, the variants. So the virus is constantly changing. And when a mutation, a change happens that increases its ability to infect people, then that one is going to grow more. So what happens is by random mutations, you start selecting the viruses that are able to target people who are fertile ground for the virus to grow. So because the young people and the children were not really exposed last time, these mutations occurred. And once they find some that can infect kids, well, now that can spread and it can really magnify the number of viruses that there are that can infect the children.
Wow.
I do just want another component that's important to keep in mind is that a lot of the elderly have been vaccinated. So one of the reasons why we're not seeing the elderly right now is because many of them, they knew they were high risk and they got vaccinated. We just need everyone else to be aware of that they are at risk even if they're young. And if you can get vaccinated, to get vaccinated.
Wow. And so for those people that are still very fearful, and we're seeing reports and stories every day that people felt like if I get it, especially if I'm younger, that it'll be, as our former president said, just like a bad flu. And for many people, it has been like a bad flu. But now we're seeing those people at the end of life saying, I wonder what would have happened if I got vaccinated. What do you say to people, Dr. Zapatero, that wait and get sick and have to be intubated about now we really, we're just at the peril of the virus?
I think for all those that are not vaccinated, a lot of the people, when they get sick, it's too late at that moment. We really don't have great treatments. The monoclonal is the best. And when we look at the people that are getting sick, the vast majority of them are unvaccinated. And the people who have been vaccinated, we're millions, hundreds of millions that have been vaccinated, and we're not seeing, major side effects. So the risk of getting the virus is a lot worse than any risk of the vaccine. And once again, once you get it, it's too late. So the only way that the vaccine works is to get it and get it as soon as possible.
Mm-hmm. So just let me be clear for those people that, because people are testing positive now more and more, we're seeing it in the clinics and we're seeing it overall. Are there going to be enough monoclonal antibodies to go around for all of the people who will be positive to try to circumvent them going further into, this disease process?
We had a call with the governor this week. They're well aware of the rapid rise, and we did make the request. So far, we've been able to get the monoclonal antibody, and they're going to be reaching out to the company to prioritize Louisiana because we're one of the states where we're seeing the biggest rise. So we want to make sure that we have more than enough. At the current time, we do have the monoclonal antibody. It really is making sure we have enough nurses that can administer the monoclonal antibody.
How concerned, Dr. Zapatero, are you, before we've got to let you go, about school reopening in just about 2 weeks?
We're all very concerned that may just increase the exposure of people to the vaccine, and then more people are going to get sick. What we notice is usually after holidays and events where people got together, like Thanksgiving and recently the 4th of July, it just causes a surge. And the school may accomplish that, particularly with it infecting children as powerfully as it is.
Wow. Dr. Zapatero, thank you for this very important information. We are going to keep doing updates, keep encouraging people to get vaccinated, to help not only themselves and their families, but to help the community and to help our state. Thank you, Doc. Stay well, and God bless as you guys continue to fight this treacherous virus.
And thank you.
Indeed. Hey, everybody, stay on point. We're back right after this.